Assalamu alaikum. Welcome everyone on board. Um, we had started elderly uh, patient for anesthesia, and we discussed some of the uh, highlighted concerns and challenges which you face when you are anesthetizing an elderly patient. Um, any question regarding that discussion which we have started? Actually, yesterday when we were doing this fracture neck of femur, I should have just highlighted some of the concerns related to the surgery, orthopedic surgery, like bone cement syndrome, and some of the concerns related to bleeding and how to uh, replace the blood and blood products in elderly. We will cover inshallah when we'll discuss orthopedic anesthesia. Okay. So today we will just try to take a scenario of a elderly patient for cataract surgery, which seems a very simple thing, but actually when you are asked to do monitored anesthesia care for this elderly patient, it's a quite a tricky thing. Okay. So, if anyone wants to take a lead um, about this scenario, just raise the hand. Like an elderly patient who is posted for cataract. Okay. So, what will be the considerations? What will be the things which you should be considering? Uh, Dr. Abu Bakr, would you like to say something?
Assalamu alaikum. Yes, sir. I believe we'll be having some general concerns of uh, we have for the elderly patients, and along with that, we have to keep in mind. I think we are talking with respect to the cataract surgery, right?
Yes, yes. We actually
Because I've
there
just
are certain whenever we discuss or prepare any topic, there are certain blocks like this thing may be asked for any other surgery for an elderly patient under monitored anesthesia care, for example. Okay. So because the concerns will be related to what now, just think about it.
uh,
Because, for example, if you are giving general anesthesia, then things will be a little bit similar to in any other surgery for elderly patient. Okay, but here we are considering a patient for cataract surgery in an elderly age group under, for example, monitored anesthesia care. Okay, so there will be certain challenges which you will have in this patient. What will be those challenges? Actually, in this patient, you will need, for example, because this is eye surgery is a delicate surgery. You need the patient to be in calm behavior, like he's not moving. Okay. And if, for example, the thing which is common in this age group is the tremors, uh, tremors which may be because of any neurological problem, or tremors which are due to like weakness, and in that scenario sometimes it will be difficult for the surgeon to perform the surgery. Okay. And this is one thing. Other thing is that if there is coexisting respiratory problem, okay, and patient is unable to lie flat on the bed, then this will be a consideration. Okay. Then there may be sort of claustrophobia. If patient is awake and you have put a big sheet on the patient, this may be unacceptable to some of the elderly patient. Okay. So things will be related to that thing. And another thing is that because in the back of the mind of the surgeons that we are not doing it under general anesthesia, so sometimes the preoperative evaluation may be missed. Okay, and this age group will have hypertension, diabetes. Okay, and because some of the complications of hypertension in the form of retinopathy may complicate the scenario if the patient is not well controlled. Okay. So any other thing which you now you can think about it. So just a question to which anyone can answer. What is monitored anesthesia care? Azhar, would you like to say what is monitored anesthesia care?
So, monitor anesthesia, in this anesthesia, apply, we monitor all the vitals of the patient and give sedation. And we watch for any complications, and we vigilantly look for any complications.
Is it mandatory to give sedation?
No, sir. It's only if it is required, sir.
Like it is the provision of the monitoring provided by a trained anesthetist with or without giving any anesthesia. Okay, like
Okay.
monitored anesthesia care. Okay, so it may be like a conscious sedation. What is conscious sedation, for example? What is conscious sedation?
Sir, mild sedation where patient is arousable or responsive to a stimuli or to talk.
Yeah, like mild stimulation or verbal communication is there. Okay,
Verbal communication.
so it may be in the form of conscious sedation. Okay, or maybe in the form of, what about the local blocks, which actually the ophthalmic surgeon is giving. Okay, so usually in our setup, there are very few anesthetists which are giving these retrobulbar peribulbar block, but actually in some part of the world, there are specialized anesthetists who are dealing mainly with ophthalmic anesthesia. They are giving the blocks as well. Okay, so actually it's a you because it's a unfamiliar thing for most of us, so we don't discuss these things, but actually there are certain concerns related to that. Even if the surgeon is giving local, or if the surgeon is giving retrobulbar block or any peribulbar block, so there can be development of subtenon block. There may be development of local anesthesia toxicity. Okay, though they are giving in a minute doses and they are expert in it, usually does not happen. But when you are being involved, then you should be taking care of it. So you will applying the standard 1, standard 2 monitoring, and you will be observing the patient throughout the procedure, and you have to be cautious about these things. Okay, even if the surgeon has given this one of the eye block, or if they have used like for example, usually it will not be used much in this scenario, but they might be using some mediatric. Okay, atropine, for example. So atropine is absorbed in the circulation and it can cause tachycardia. Okay, and then it will have the similar situation of the if any compromised heart may decompensate because of tachycardia. Okay, so I actually it looks very simple, but you should be taking care of these things, because usually these patients may be ASA 2 or even ASA 3 patients will you can have those patients like that. Okay, so as mentioned over here, some of the things, and another challenge will be related to any antiplatelet, anticoagulants they are taking. Okay, so this is some of the points which you need to know. Okay, they have just actually this article is related to preoperative assessment in ophthalmic regional anesthesia, and usually these are the patients who are usually of elderly age group. It can be a young patient as well for corrective surgeries. Okay, which may be done under mild to moderate sedation. Okay, corrective surgery. There are so many procedures which are being done in elderly patient as well. Okay, so sorry, in young patients as well, in addition to the elderly age group, but majority of the group are those people, those patients. Okay, so just a second. These are actually high. Usually these things will not be asked usually to us. It's related to mainly specialty of eye. Okay. In MCQs, they ask about these blocks. So do anyone have any idea about these three blocks? What are the differences in these peribulbar block, retrobulbar block, and subtenon block? Anyone has got idea? Yes, Azhar. That in which block you need to give a separate block for facial nerve. Yes, Azhar.
So sorry, I don't know, sir.
Is it retrobulbar block or peribulbar? Actually, it's hard to pronunciate. I think it is retrobulbar block. You need to you don't need to give. Just a second. These patients going for cataract surgery, any comment which medications these patients can be on? What are different medications which these patients can be taking? The medications may be mediatrics, okay, or drugs which are dealing with the intraocular pressure, okay. So and some of these medications have relationship with the because if they are absorbed like beta blocker or like I told you, atropine, okay. So these if will have systemic effects, and also if some of the patients not really cataract, but usually if we just discuss all other medications, like patients are taking steroids for diseases like uveitis, okay, they are taking long-term steroids. So if you happen to have any patients who is taking steroid, you have to consider about their absorption and their replacement accordingly. Okay. So some words about uh, what are the ways to deal post-operative cognitive dysfunction in elderly patient? How would you like what are the factors by which you can avoid the development of delirium or aggressive behavior, and how will you manage?
Sir, first of all, we have to uh, familiarize the patient with the environment, and make easier for her or his sleep cycle. And if and the medications like benzodiazepine are the risk factors for the delirium, so we need to avoid it. and all the risk factors, which are some are the physical, some are the pharmacological. So we have to avoid it, and we have to keep the patient in a
Then, other
comfortable.
than benzodiazepines, which are other factors?
So alcoholics
Okay. Alcoholics.
and
What else?
yeah. Patient having pain, having already
Hypothermia. Hypothermia.
yes, hypothermia, sir.
Electrolyte imbalance. Okay.
Sir, sir.
And use of general anesthesia is more associated. Inhalational agents, like in pediatric patient we discussed. Okay. And urinary retention. Okay. Prolonged surgery, prolonged anesthesia.
Sir, sir.
And actually benzodiazepine, some of the people they will be confused. Even I also become confused that benzodiazepine is also given for the treatment, as well as it is also a risk factor. Okay.
Sir, yes, you are right.
Similarly, one other finding which was very strange for me was that use of ketamine actually reduces the incidence of postoperative delirium if you are using it in a small dose. So it is also a
Sir,
confusing thing. Okay.
sir, sir.
So you just have to avoid as many factors as possible. Hypothermia, as I told, hypothermia,
Sir,
poor
even
pain
sir,
control.
depression, dementia, and previous strokes, and yes, aged patient more than 70 years is also a risk factor for the delirium, sir.
Yes. So what is the usually this one? What is the treatment? The drug of choice is haloperidol.
Haloperidol.
Okay. So
So
they are
if the
giving
haloperidol is contraindicated,
then
then we will use olanzapine, sir.
olanzapine.
Olanzapine or
Okay.
even benzodiazepine. If the both haloperidol or olanzapine are contraindicated, then we will use benzodiazepine, sir.
Okay. We have just tried to cover some of the we have actually discussed some of these. This is FRCA mind map, just to review and revise the concerns in elderly patient. Okay, and we have passed through it. I was just trying to see if we find any point related to uh, this delirium. And yes, this is actually as you just a second, please. Aspects of cognitive function tested by orientation in time. How to there are some things which some detailed words about it, that they are checking orientation in time, orientation in place, repetition of named objects, repetition of simple phrase, ability to undertake simple arithmetic, recall of objects named earlier in the interview, naming of the objects shown by the examiner. This is actually, I don't think so. They will be asking you. Actually, it's a, it's a, sometimes you just have to extract and scan what are the important points which are to be like this part of the thing will are more important. Like sometimes there is if there is embolism, this is one of the cause of postoperative cognitive dysfunction. Okay. And similarly, perioperative physiological disturbance, as we discussed, the electrolytes like sodium, hyponatremia, hypoglycemia. This will be one of the factor there. And if the patient already has some psychiatric problem, then there will be more chances, because all these are related to the neurotransmitters. Okay. Mm, conduct of an, you see, there is no strong evidence to support the use of any particular drug. Okay. So you just can avoid the factors, and then you can, you see, benefits of regional over general anesthesia, as we discussed. I'm just trying to scan any important point. Yes, you see, increasing age, which are factors for postoperative cognitive dysfunction. Increasing age, general rather than regional anesthesia, increasing duration of anesthesia, respiratory complication, lower level of education, repeated surgery, reoperation, postoperative infection, prolonged POCD months postoperatively, like increasing age. Okay. So this topic may be asked to you, or if you are discussing any elderly patient, you can mention about these points. Okay. We are just trying to wrap up few of the things. We will discuss another scenario in our next session about this one, TURP. Okay. So just going. They are just some words about. I don't think so. This is a very good source. Usually, what sort of assessment other than a normal preoperative evaluation you may need in elderly patient? The sum of the points will be related to, like for example, there is physical limitation for movement. Okay, then you cannot assess. Then you will have to go for, like, you cannot assess the physical activity. Like if they pay the old baba has osteoarthritis. Now you cannot evaluate the patient purely on the physical activity, and you will have to go for stress testing. Okay, what will be those stress testing which you can use? Pharmacological stress testing, the butamine stress echo, or stress thallium scan. Okay, and other will we already discussed related to preoperative assessment challenges because of this one, problems in hearing and vision. Okay, and these are the things which we have already discussed. Some of the things I'm just passing through them. If I find any, you see, the cat in the hat. You see, some of these, I don't know from where I have found this, but somehow it is good. Okay, so for during, you know who. Okay, so these are, I think, some of the points which they have: complete medical history, present part, routine activities, mental and physical status, dependency, associated diseases, nutritional status, drug history. Okay, these are normally things always see for depression, malnutrition, immobility, dehydration, denture, and pacemaker. Okay, because of some cardiac problem.
Oh,
You please,
वो
can you
password बता देना.
mute? Can you please mute your mics, please? This is disturbing for everyone. Okay. Okay. Any comments or anything you want to discuss, please? Because we will discuss this TURP in our next session separately. We have discussed a number of things. I have just tried to give you a vision because elderly patients are like among just like a pediatric patient or pregnant patient is one of the thing you should have a very good concept. Okay. So I think we will stop here. Any comments or any question? Anyone wants to ask anything? Okay, just we will inshallah do TURP in our next session. Okay. Thank you very much.